Hey guys, welcome back to the channel. So today I wanted to talk about something that vet school did not prepare me to deal with. And this is a case that actually I saw today and sort of last couple months ago. So I'm gonna start out with kind of the story about what's going on and then kind of dive into this topic of what did vet school not prepare me to deal with. So about 8 weeks ago, I had a dog come in to me that had a broken front leg. And the reason that it broke its leg is it jumped off of something or something along those lines. And it was a radial and ulnar fracture. Pretty common in smaller dogs. And just because of weird abnormal force, don't remember exactly what caused it. But we went through and talked to the owners about the consequences of what we can do, what we can't do, what our options are, and basically came down to, yes, we need to splint this leg. It is a splintable fracture and we can probably fix it as long as things are taken care of correctly. So 2 weeks later, the dog came back in, changed his bandage, no big deal. And then one more time, the dog came in. And the last time we saw the dog was about 3 weeks after the fracture first occurred. So then today, this dog came back in again. Now, we had an appointment on the schedule. They were supposed to show up earlier, but they didn't. And so this is very interesting because it's like, well, okay, we have a dog that we've had a splint on. It's wrapped. We told them we need to see it at minimum every 2 weeks or any time that it gets wet because we really don't want any sores. We don't want any rubbing. Can get pretty nasty and can get pretty ugly. So we talked to the owner today because I brought him in because it was starting to smell. Now, when a cast starts to smell, it's usually not a good sign. It usually means that there's an infection of the skin. So usually it's not a huge deal. Usually we can, treat it with some antibiotics and continue to wrap it. Now we are at 8 weeks past when we first splinted this, so hopefully the fracture is healed, but we really need to confirm that with x-rays because if we take the cast off too early, if she didn't heal quickly enough or refractured it or anything like that, we really want to splint it longer to make sure that we don't refracture the leg. And so basically it's been 8 weeks, take the cast off. And this is the picture of the leg that I took today of what the leg looked like when we were taking this splint off. And this is a very unfortunate event. It's super painful. I can't imagine being this dog with those sores for that long. And the infected skin just had to be unbearable. So we're like, hey, we really need to take an x-ray to make sure, one, that this fracture is taken care of. And we also really need to treat this basically now open wound. And the owner comes back to us and says, I have $50 to spend today. For anybody who's gone to the vet recently, that is not a lot of money to spend. And I'm not at all, let me clarify this right now, I'm not at all denigrating or think that these people should be ashamed. I don't think that they definitely should not be talked down about. This is not about them. They did everything that they could, and if you only have $50 to spend, you only have $50 to spend. That's the way it is. And I think one of my future videos here is going to be about, should poor people have pets? And I have some really interesting topics to talk about because some of my clients who have a little bit more money, some people who are in my fields think if you can't afford to have a pet and fix all of their problems, you shouldn't own one. And I think that's a really interesting ethical and moral dilemma. And I want to talk about that in a future video. But these people did whatever they could. They're like, we only have $50. There's nothing else I can do. So vet school did not prepare me to deal with this. Vet school did not prepare me to deal with, I only have enough money for nothing. So our practice is pretty reasonable for what we charge for a lot of these things. X-rays, we only charge $100 for 2 views. We charge, about that. And so I'm like, hey, I can try to cut you guys a little bit of a deal. I know you guys are really in a bad financial place, and I'll do everything I can. But they just only had $50, and so that's all we could do. So I talked to them, and we decided that the only option is to treat the wound and assume that the bone is healed, and with restrictions at home being, they have to be extremely strict for the next couple weeks to make sure that it actually is in fact healed. And I wasn't even able to charge for an exam because they did not have enough money for that. Even though I did perform an exam, just was not able to even charge for one. So vet school really did not prepare me to deal with, I have $50 to spend. And $50 doesn't even cover our medical exam. So if there's some issue that we need to resolve, it doesn't even cover that first initial exam, let alone any diagnostics, let alone anything else. Our x-rays for 2 views, which are generally required, or 2 views, is $100, which for us is really reasonable depending on where you are in the country. It can be anywhere from $200 to $300. So one of the things that I've learned as a veterinarian is really to understand what we see most commonly. What is most common? And test for that first. Or if you don't have any money to test for something, assume it's that until you are proven otherwise. Because even though that's not good evidence-based medicine, a lot of times when you have a really limited budget, that's what you have to do. And it's not because you're being a bad vet, it's because that is the only amount of money that you have to spend for this client. The other thing that I've really learned is that not every client that can't spend money just chooses not to spend money. Some of them just really have no money to spend, and a lot of them overextend their budget despite not having any money. They put themselves into debt for their pets. So that's really the challenge, is when people come in with a pet that has a serious medical condition that we need to address. As a veterinarian, it hurts my heart when people say, I only have this much money. What can we do? And it's like, well, I can't do much for you for that amount of money. I can only do this and this. And having to decide between doing a treatment and doing a diagnostic to have a good diagnosis. Because every treatment is more effective if you have a proper diagnosis. If you don't have a proper diagnosis, it's a shot in the dark. You may have some guesses and you may know what's most common, and you should treat for those if you only have X amount of dollars and you cannot do anything else. But it also is really challenging because you have to make those decisions, and the decisions sometimes are very difficult. Of, like in this case, do we take a risk that all the work we've done in the last 8 weeks is for nothing because she goes and breaks her leg because it wasn't healed? Or do we treat the open wounds on her skin, her infected leg? And how do you decide that? And one thing I would really say for you guys who maybe are out there with a rabbit or with a dog or a cat that really can't afford much is, don't ever be embarrassed to tell your vet, I only have this much money. You should never be looked down upon for saying, I only can afford this. Because it's your vet's job to work within that constraint. And sometimes there's only so much they can do, and they may say, well, if this is all you have, I can take a guess, but we may not fix it. And that's okay. Just tell them, hey, this is what I have to work with. Can you please work within this budget? And many times they will be willing to and able to. So I thought today I would at least share that case with you guys and show you this picture over here, which is pretty crazy. It is probably going to be okay, even though there is an open wound on this dog's elbow called the olecranon. It's right here at the tip. And there's also an infection all around the skin. With antibiotics and with pain management and a topical therapy to help clean up that infection, she should do okay. The leg should be healed, but there's always that little thing in the back of my mind. What if it's not? What if it's not healed? What if? And that's the question we always get into as vets. Maybe that's something for you guys to understand, is that every day we go home, we don't get to leave our work at work. It can be extremely difficult for a veterinarian because Every time I come home, I'm like, what if I did this differently? What if I did that differently? And the other thing that I really wanted to talk about is that if your vet makes a mistake, or if you think what if about something your vet may have missed the first time through or wasn't obvious, realize they're probably thinking about it too. And they really are struggling with each and every case that they deal with. Every time they go in and have a wellness exam and everything goes well, fantastic, easy. But what if you miss the mass? What if you miss something significant and it causes that animal to have severe disease that costs more to treat? Or what if it causes that pet to die earlier? That really can weigh on a person, and I want you guys to realize that and just be okay with your vet making mistakes. I mean, if they make some serious, obvious, blatant mistake or are doing things incorrectly, obviously talk to the board in your state, the Board of Animal Health. But if they make a simple mistake or if they seem to have missed something small, give them the benefit of the doubt. They probably didn't mean to. And if they're like me, which many of them are that I know, most of them are that I know, they're just trying to do the best for your animal and trying to live life and help you guys out. And they really give their heart and soul to this profession. So I'm just really tired, guys. So I'm gonna stop rambling here. I hope you guys enjoyed this video. And even if you didn't enjoy it, I hope you guys learned something from it. Have a great rest of your day, guys, and hopefully you enjoyed this video. If you did, like and subscribe. And if you are subscribed, hit the little bell as it will notify you when my next video goes live. Have a great rest of your night.